Hi, I'm Elizabeth Miller, and I wonder if you know this about dementia, its prevention, intervention, and care. The following thoughts are largely based on my studies in dementia care and on a paper which was published in 2020 called The LANCET Commissions, Volume 396, Issue 10248. I will give all my references at the end of the slides in more detail. The number of older people, including those living with dementia, is continuing to rise. Worldwide, around 50 million people live with dementia, and this number is projected to increase to 152 million by 2050. Dementia affects individuals, their families, and the entire economy, with global costs estimated at about $1 trillion every year. Of all the dementias in the world, 40% could theoretically be prevented or delayed. The Lancet Commission's paper lists 12 modifiable risk factors. Let's look at them one by one. The first risk factor listed there is having less education. We can't overestimate how important it is for children to learn different ways of connecting things in their brain. The less education people had when they were children and the less education they have later, the higher the chance for them to develop dementia later in life. Another risk factor is hypertension, hearing impairment, smoking, obesity, depression, physical inactivity, diabetes, and infrequent social contact. Now think about social media and what it does to our young people. Excessive alcohol consumption, head injury, and air pollution. The good news is, it's never too early and it's never too late in life to address dementia prevention. Being socially active and interconnected reduces the risk of cognitive decline later in life, regardless of gender, social, economic, or lifestyle factors. Air pollution, as in exposure to PM 2.5, NO2, and carbon monoxide increases dementia risk, while exercise helps to maintain cognition. I think that is very, very good news. Well, as mentioned before, lifestyle changes do reduce the risk of dementia. Invest in relationships by building and cultivating harmony at home, and connect with people that have common interests to you. Volunteer in a community. Engage in further studies which will increase cognition and brain volume. You can reduce your dementia risk by spending more time in nature, away from wildfire smoke and traffic exhaust. Being diligent in airing out your rooms. Don't smoke and avoid secondhand smoke. Engage in gardening. Combat indoor air pollution with the aid of an air purifier and plant cultivation. You can minimize your journeys by car and plane and commute, for example, by e-bike. To increase cognition, extend the duration of weekly sweat-inducing, moderate to vigorous aerobic exercise to be at least 2.5 hours in total. And choose to walk more. Be an overcomer to reduce risk of dementia. I know relationship cultivation is hard work and time constraints are real. In order to be socially interconnected, we must plan and make time for people within and outside our current circle of relationships. Instead of waiting to be invited, initiate a meetup in a cafe or on a walking path. This could be for social chats, intellectual discourse, sharing a hobby, or virtual meeting. Where relationships are problematic, get input from a friend or a coach or literature. Relocate, if at all possible, away from traffic and other air pollution. If that is not possible, do purchase an air purifier in the bedroom or other rooms to reduce brain disease, which is caused by airborne particle pollutants. It's very well documented. Some time ago, I exchanged jet setting and car commutes for e-bike rides, taking advantage of Greater Melbourne's extensive cycling and walking network, often through scenic parks along the river. This, together with regular exercise, reduces my risk of dementia, depression, and also age-related deterioration. Get serious about prevention. Aim to maintain a systolic blood pressure of 130 mm or less in midlife from around 40 years of age. Very, very important. Encourage the use of hearing aids for hearing loss and reduce hearing loss by protection of the ears from excessive noise exposure. Reduce exposure to air pollution and secondhand tobacco smoke, as we have said before. Prevent head injury. I'm amazed how many girls even use header shots in their sports. Very, very dangerous. Prevent it at all possible. Limit alcohol use, as alcohol misuse and drinking more than 21 units weekly increase the risk of dementia. It's vitally important that all children attend primary and secondary school, and that people as they're older continue to engage actively in learning. Reduce obesity and the linked condition of diabetes. Sustain activity, physical activity throughout midlife and, if at all possible, also later in life. Address all other alleged risk factors for dementia, like sleep, through lifestyle interventions, and general improving of general health. Tackle inequality and protect people with dementia. And for those who already do have dementia, it is recommended that they will be provided with holistic post-diagnostic care to address physical and mental health, social care and support. Most people with dementia have other illnesses and might struggle to look after their health, and this might result in potentially preventable hospitalizations. I thank you very much for listening and trust that you found this valuable. Goodbye.